How can we help our kids detoxify from heavy metals or other environmental toxicants? You're listening to the 2025 EMF Hazard Summit. My name is Nick, the EMF Guy Pinot, and this is the EMF Hazard Summit, Protect Your Children. In this presentation, Dr. Anju Usman will reveal what kind of toxins she sees in kids and teenagers these days and how she helps families rid their bodies of these toxic exposures. Dr. Usman is the director and owner of the True Health Medical Center and Pure Compounding Pharmacy in Illinois, USA. She serves on the medical advisory boards for Documenting Hope, the Autism Community in Action, and the Autism Hope Alliance. I'm here today with Dr. Anju Usman. How are you, Anju?
Oh, I'm doing great. It's sunny out today in Chicago.
Oh, well, it doesn't show here, but it's actually sunny in Montreal. It's just that the studio, the sun come that way and doesn't look good. So I decided to go with a darker look for my interviews. But it is sunny, and I'm very excited to talk about a topic that's near and dear to my heart. I was just telling you that through my own investigations, I found out that one of the reasons I might be EMF sensitive and have this state of lower resilience than I'd like. I tend to get sick more often than previously in my 20s. And I'm 37 right now. And one of the things I've discovered is that I have a high load of heavy metals. It's just there, these things have accumulated inside my body. But what I've learned from other practitioners that also practice environmental medicine like you is that these chemicals can accumulate over time, but they're also present in our kids. And now I'm thinking about my kid and I don't know exactly what to do. So I want to talk about environmental toxins and detox in kids, if you're willing. I know that you have your own story that you told on your website that I saw from your own children getting sick from environmental exposures. Maybe we can start there. How did you discover for yourself that your kids were impacted by these environmental toxins?
Well, thank you, Nick, for having me on your show. And I love talking about these things. I've been working with children, mostly children with special needs, since 1995.
Wow.
And so, again, over the years, I've just been watching kids get sicker and sicker. And, we have epidemics of things like asthma, allergies, diabetes in children, epidemics of ADD and autism. And we're always asking that question, what's going on with our kids? Mm-hmm. And you kind of hit it on the nail on the head in that there must be something in the environment that's kind of pushing the envelope a little bit, because there's no such thing as a genetic epidemic. And so there's something in the environment. And what I've been seeing with kids is chemicals, metals, mold play a big role in people with chronic illness. And you asked about my kids, and it kind of got me here where I am today. My eldest was born 91, and she came out with peanut allergies, food allergies, chemical sensitivities, asthma. And she actually ended up passing away from a peanut allergy when she was 12 years old. And I do talk about it a lot because she's my inspiration. And, we do a lot of things for our kids, and she's taught me a lot. And then my other daughter ended up with type 1 diabetes and allergies and asthma, mold sensitivities. And my third daughter, she has something called chemical sensitivities, where even parts per trillion or parts per billion of chemicals, it affects her immune system so much she couldn't go to school. She couldn't leave our home. She can't go to a public place because my kid's immune system is now not tolerant to things like EMFs and chemicals and metals. And so my patient population is very similar to my kids. And over the years, I've learned how to kind of figure them out and deal with these kinds of issues.
So how do we get started when it comes to identifying if our kids could be impacted by certain toxins that have accumulated over time? I know that's this is a very, wide issue, but what's the step number one?
First of all, we always think of kids as being pretty clean, why would a kid have all these toxins in them? They should be pretty healthy. But I think that, in our environment, as a load increases, our moms tend to have a bit of a toxic load too. And when you're pregnant for 9 months, a lot of that load is then, given to your child. So we used to say that the kids are born, we call it like tabla rasa, like a clean slate. But now, like when they did environmental working group did a study on newborns, and they found hundreds and hundreds of chemicals in newborn babies, in the placenta, in their blood. So, our kids are starting off at kind of in a negative place already. And as your viewers know, we're kind of bombarded with a lot of things that our parents weren't bombarded with. In my patient population, which has to do mostly with children with autism, what we're seeing is they have some underlying genetics where they can't detox very well. So if you throw this kind of underlying genetic predisposition and families that don't detox very well, families with autoimmune issues or immune issues or GI issues, and then you throw in these toxins really early on, then the burden just kind of increases and increases and increases. And then a point happens where the system can't handle it anymore. And it's almost like a tilt in the system, and some of our children regress. So they're doing okay. And then they have these episodes where, they're having trouble with attention and focus and language. And so my job as we call it biomedical or functional doctor for children is, okay, so let's look at the genetics, maybe the epigenetics, that's the environmental role. And how do we look at the environmental role? Well, we look at air quality, water quality, food quality, and then we can do some testing to figure it out too.
So I know there are many different ways of testing. Is there one in particular that usually is recommended for kids, just the urine test or the provocation test? I know that's something I went through and I discovered that myself. My God, I have high mercury, high lead. So, but I've been told most people would have, bad results if they get tested. It's just that the average person on the street would kind of raise an eyebrow over like, what, testing for heavy metals? And yet probably everyone should do it. So is that where you usually start?
I don't necessarily start there, because we're dealing with kids. I usually tell the families, number one is cleaning up the environment. We don't want to put more garbage into the body. We want the body to be able to manage and take things out. When we have some type of a chronic illness or something that we're dealing with chronically, then we know that the body isn't handling things the right way.
Yeah.
So again, then we try to do these deep dives. But the number one thing I tell families is cleaning up your environment. Soap, shampoos, cleaning agents, detergents, perfumes is a really big one. Avoiding aluminum cans, aluminum pans, aluminum foil, aluminum deodorant. You talk about EMFs, that just kind of adds to the load of the leakiness. So when you're leaky, things enter the body that really shouldn't. And one of the big metals, we're exposed to metals all the time. We're supposed to be able to get rid of them. But sometimes this low level exposure over years and years and years, it does build up. It does build up. You mentioned a provocation test. So how do we figure out metals, for instance? So we can do testing on things that come out of the body. So we can test things like hair. A hair gives me a 3-month window of what's coming out. And I can look at metals in the hair. We can look at urine, a random sample, and see what's coming out. We can do stool testing and see what's coming out. But as I mentioned to you, a lot of people with chronic illnesses, they don't have the bandwidth. Their immune system doesn't have the bandwidth to detox. So things aren't coming out. So if I measure what's coming out, I don't see much because my body's weak, my adrenals are weak, my mitochondria is weak. I'm not able to have the energy to detox, or I have some genetic issue where I can't detox. So then we use the word provocation. So that's what you did, right? Like your doctor gave you a medicine to try to get the metals out of the body or provoke them to come out.
Yeah.
And that's considered the gold standard. So what we would do is we would do a urine test before and see, okay, there's not much lead or aluminum coming out. Then I'll give a medicine to provoke the metals to come out. A common medicine that people use is called DMSA, or another one is called calcium EDTA, or another one is called DMPS. They're different medicines and they pull out different metals. So then we would provoke the body to get this out and then collect the urine again. And the kind of the standard thinking is if you go up 6 times, so say you do a pre-urine test and your lead is 1, and then I give you DMSA and I collect your urine again, and now your lead is 20. It went up by a factor of 20. So the thinking is that if it goes up by a factor of 6, then you have a burden of metal in your body that you're not getting rid of.
It's not good news for me. Yeah, 20 times is a lot, right? That's what it told me. So I'm working on it, but
20 times is a lot. Six is kind of like, okay, we all have a little bit of a burden. I'll give you some medicine. Some of it will come out. But again, it's the quantity. Some people use the term the dose makes the poison. The more you have in your system, the more problematic it is.
Yeah.
But these people who are really sensitive, like our patients with EMF sensitivity or chemical sensitivity, or patients who are just really sensitive to infections and they get sick a lot, those sensitive people, for me, there's no good level of toxins in their system. Their system can react to even small levels of toxicity.
Yeah.
So I use the example of my daughter with the peanut allergy. It doesn't take a lot of peanut if you're sensitive to something to cause a problem. So the numbers are a little tricky because people like to see high numbers coming out. And, you can show people, yeah, you have a lot. But if you're super sensitive, even a little bit is going to make your system taxed. And we know the detriments of things like lead and aluminum to our kids, our brains, our immune system. So many problems with low level exposure to these things. And it does accumulate in everybody, even children.
Yeah. And I've heard about children who were born of a mom that has, for example, silver fillings. That was my mom. So the part of the theory of our hypothesis with my practitioner is that, well, maybe you got it from mom, and thanks, mom. I mean, she offered me a lot of good things in life, but unfortunately she also passed a bit of mercury to me. She probably did. So is that something you see where certain moms are very heavy metal toxic and then their kids has this same kind of portrait showing up?
Yeah. Yeah. Unfortunately, I don't like to put guilt on mom, a whole bill, more guilt.
Yeah,
Moms
sure.
already have that guilt concept anyway. But yeah. So when we take a history, we ask those questions. Amalgams or the silver fillings, they're actually not silver. They look silver, but they're mercury fillings.
Mm-hmm.
And so that's one question we ask. And then, there's other things that some of our patients get. I don't like to talk negatively about vaccines, especially, in these types of groups. But just so people know, there is a load of mercury in some of the vaccines, and there's quite a bit of a load of aluminum in the vaccines too. And I think that's just knowledge that people need to know that it is there and it's going into the system a bit unchecked. So there's a potential load there. And then, there's different municipalities with low level lead in their water supply. We've heard about things like places like Flint, Michigan, for instance. And I know like some, counties around Chicago too. And I did my residency at Cook County Hospital. I don't know if you've ever heard of Cook County, but it's like
No.
a really, kind of a inner city hospital with all the stuff that you see from inner cities. And I was there during the 90s, late 80s and 90s during my residency. And I had a lead clinic. So my whole clinic was just dealing with children with lead.
Wow.
And these were kids in the inner city. And that's kind of how you think about them, is that they had lead paint back then. And these are kids in the inner city, and the lead paint tastes sweet. So the kids would like scrape the paint off the walls or off their cribs and eat it.
Oh my God.
So
Okay.
one of the big symptoms of lead issues or lead burden or lead toxicity is what we call pica, where they're putting things in their mouth that they shouldn't, like dirt or paint, and they're just eating inedible objects. That's a big sign that there's kind of a metal issue. So when I was in residency, the safe level of lead was 60 in the blood. Then they changed it to 40. Then they changed it to 20. Then they changed it to 10. Then they changed it to 5. And now it's 3.5. Now, if you look at the CDC and you Google what's the safe level of lead, the CDC will say 0. And
Yeah.
our IQ drops by about 7 to 8 points when our lead goes from 0 to 1. So
So,
that's a fair amount of
I
IQ
mean, I
change from
think
a low
about,
level.
I mean, I consider myself a fairly smart guy, but at the same time, I feel like maybe I'm going to be super smart once I get the lead out. It's just lead and mercury both, and well, along with other heavy metals. I know there's arsenic, there's aluminum. Some people have high level of also. What is it? There's also a few other ones that are less talked about, but I'm wondering if you want to talk about detoxification strategies. I know that obviously, how can I put this? If I wasn't able to get a health practitioner to look at my kid that knows what they're doing to test them first, I wouldn't necessarily look into anything like chelation or any of these modalities that I've seen some people kind of navigate by themselves. That's something that I've learned over the last 15 years to never do, never recommend, because it's just too tricky. And I have a story I can share with you, and I guess with the audience, because they can learn from my mistakes. I self-navigated taking the MSA a few years ago. So that's a medication that you can obtain through, and I did obtain it through a practitioner, but the practitioner was not following me very closely, and Nick was responsible for taking the MSA and seeing how he feels. Okay, but we didn't know there was the high mercury, high lead situation because I wasn't properly tested before. And I slowly, gradually increased the dose. And one morning, I was stuck inside the vestibule leaving my building. And all of a sudden, I felt unable to open the door and to leave. And I was stuck in a panic attack for 20 minutes. Almost, I guess it's almost a panic attack or something that completely scrambled my brain. And I could not understand how to open the door. And it scared me a lot. And since then, I've been very prudent towards detoxification and taking these agents that will pull these metals from your tissues and put them into circulation for elimination. But my elimination pathways, as I kind of tested now, are very poor. So I got to be very careful. So that's my example of how not to do detox. Now, please let us know. Is there a way we can do detox in a gentler way or in a way that is safe for our kids?
Yeah, because as you mentioned, even though we're talking about chelation, that's kind of an end stage strategy.
Uh-huh.
And you have to be with a practitioner that knows what they're doing. So it's not something that I would ever take on by myself as a non medical person. So, what are some of the safe strategies that we use in the children to kind of get their body to let go? I think you mentioned it, but you want to make sure that your pathways of elimination are open. And we call those emunctories. That's your liver, your kidney, your lymph. And so, how do we kind of go about doing this? One of the statements I like to tell my families is garbage in, garbage out. So we're trying to get the garbage out. We don't want to put garbage in. So step one is cleaning up your environment, like I mentioned. We don't want to put any of that kind of stuff, clean air, clean water, clean food, clean household agents, some of those types of concepts. So number one, that. Number two is cleaning up the diet. Again, we're trying to get stuff out of the body. We don't want to be putting more stuff in the body. So, clean organic food, fresh fruits and vegetables. There are foods that help support the liver. They're more like cruciferous vegetables and sulfur-based foods like cauliflower, broccoli, artichoke, asparagus. They have a lot of sulfur, and that helps your body make certain nutrients that the body needs to detoxify. The number one nutrient the body needs to detoxify is glutathione.
Mm-hmm.
So again, we need to support the body so it can produce glutathione. So another way we can support the body to make glutathione is to support a system called a methylation system in the body. And the big nutrients that have been studied to make glutathione, like in my population, 70% of children with autism have low glutathione. And there's this woman by the name of Jill James, when she gave folinic acid, methyl B12, and something called trimethylglycine. When she gave it to children on the spectrum, she normalized the pathways to make glutathione. So one of our biggest interventions is using, sometimes we'll check genomics, or we will just give things like methyl B12, folinic acid, and DMG or TMG, trimethylglycine, so that the body can make glutathione, because that's what we need to detoxify.
Okay, so it's kind of just making sure that the right nutrients are in place in the body, which makes sense. I mean, we need nutrient sufficiency, and it was also part of the things that I had to look at because my glutathione levels were low. So imagine if I take DMSA, I increase the toxicity in my body, but my detoxification ability is very small. What's going to happen, right? Well, I discovered what can happen. You literally make yourself sick. Yeah.
Yeah. Because
the minerals, yes.
Yeah. So if you think of a metal, say we think about something like lead. Where is the lead in the body? If it's not coming out, it's in your bones, and it's in different enzyme pathways, calcium enzyme pathways, iron enzyme pathways. So it's kind of hiding. So if I pull it out, what's going to happen to those pathways? They need to be filled up with what should be there. So if I pull out lead, I need to have magnesium, I need to have calcium, I need to have zinc ready to go, ready to drop in there. And I need to have some iron potentially too, to drop in there. If I'm moving mercury out, mercury and zinc play like a role together. So I need a ton of zinc if I'm trying to pull out mercury. So if we're doing it naturally, and clean air, clean water, clean food, supporting the liver, we can use herbs to support the liver. We can use herbs to support the kidney. We can drink teas like dandelion tea to support the kidneys. We can do things like castor oil packs on the kids, where castor oil is a really nice agent that just kind of helps circulation, but it also binds to chemicals. So if you put like castor oil on the liver area or the kidney area, you can just rub it there. You don't have to do the whole pack. Sometimes we'll use things like Epsom salts baths, which are magnesium sulfate, and put the kids in the Epsom salt baths to kind of help, start the process. So those are some of the, what I would say, like more gentle kind of techniques. Drinking Fiji water. Fiji water is high in silica. Silica is really smooth, and it helps the body to kind of clear aluminum. So we support the body that way. We probably have to do some supplements. We mentioned minerals, some liver support, support for these methylation or glutathione pathways. So we use those types of things as well to kind of just, see how the body's doing.
This is great. And what about sauna? I know that sauna is in very young kids is probably not recommended, but again, you can control the temperature, the length of exposure and whatnot. I know that sweating in a state of being calm when your nervous system is calm will help detoxify. Is that a strategy that you use with kids at all? I'm wondering if kids on the spectrum would be comfortable with it, given how sensitive they can be to changes in temperature and things like that. But is that a sound strategy to explore for parents?
It is a strategy. It is a strategy. As you mentioned, some of the kids are averse to getting in those hot environments. But if we start slowly and build it up slowly and just, again, support their system with some electrolyte water or mineral water so they don't get dehydrated or depleted. Because yes, all our strategies are try to get things to come out of the body. Yeah. So sweating, peeing, pooping, constipation is a huge problem in a lot of children. And that's another thing where it just definitely needs to be addressed before you do any type of detox. Because if you're trying to get things out of the body and you're constipated, things are going to just kind of get reabsorbed back into the body. So yeah, sauna, sweating, I mean, even just exercising, getting off the couch and not playing video games and playing outside and getting sunlight and drinking a lot of water and hydrating, all those are really, good detoxification strategies. Body brushing is another one. Just using a light bristle brush from the tips of your fingers towards the heart and from your feet towards the heart. It stimulates the lymphatics. And the lymphatics is where everything gets dumped into before it gets dumped into your liver and then out through your bile into your bowels. So again, I call those kind of simple strategies to help the system kind of clear up. And then sometimes we'll use some gentle binders. I don't know if you're familiar with any of those.
A little bit, but I guess opinions on binders vary. That I found some people say, for example, that certain algae like chlorella or spirulina are binders. Others say, oh no, they're not true binders. So I guess there's differing opinions. What do you consider binders that are valid, like pectins or?
Yeah, so the binders will bind. They have different affinities for different things.
Okay.
But most of them are working in the gut. So if we've got a lead load or aluminum load that's affecting the brain or the bones, those types of binders aren't really going to get into the system. But the concept is if you can get the system less toxic, working better, then the body can kind of start naturally moving things out. So they have some value, but are they going to go in and pull out lead from your bones? No. Or are they going to get it out of your liver? Probably not. But they will help to kind of clean up your gut and clean up your body a little bit so that you can manage, the load is a little less. But yeah, like you mentioned, chlorella is something that we do use. Citrus pectin is another one that is pretty valuable. Some of our kids have mold toxicity, so we'll use things like clay or charcoal to bind mold toxins or mycotoxins.
Got it. Well, thank you so much. I know this is this is a lot for parents to take in, but at least I wanted to give them, the a good overview portrait. So I think we achieved that. At the same time, do you have education on your website that can help parents follow up on this knowledge and try to educate them a little bit better? I know you're part of a True Health Medical Center. Is that it?
Yeah, so it's my clinic. It's called True Health Medical Center. It's outside of Chicago. And I also have a compounding pharmacy to make things clean for my patients so they don't have a lot of, junk or excipients in it. Because this kind of concept is so controversial, there's not a whole lot of information about chelation specifically that I put out there.
Yeah.
I have given lectures on detoxification in children. There's a group called MAPS, Medical Academy for Pediatric Special Needs. I'm on their executive board, and our goal is to educate practitioners, all types of practitioners, from coaches to nutritionists, chiropractors, PAs, nurse practitioners, doctors, on these strategies to help children.
That's great.
And also detoxification strategies. So if you find a doctor who's been trained at MAPS, they will know about these types of strategies. There's also different groups that talk about these types of issues. There's a group called TACA, the Autism Community in Action, and they do have great education and have articles and interviews from doctors who've talked about this.
That's great. Perfect. I'll link to all of those to provide parents with next action steps if they really think this is a route they want to take with their kids. But I'd say in any case, detoxification or these strategies, just sauna, I think it's going to be essential for every citizen moving forward, just as a means of detoxification on an everyday basis, because there's air pollution, there's many things in the environment that will take centuries to clean out. Is I don't want to be completely disheartened about it, but the reality is that the environment has been toxified, and it will remain even if we start cleaning up our act, which we should do. But I think that these strategies are something we need to adopt for life. So personally, after I've learned that I have a ton of heavy metals in my brain, I started doing more sauna, and I'm following a practitioner very closely now. And I think, you've given great action steps for people to start engaging in safe detoxification practices for the kids. So I want to thank you for being part of EMF Hazards.
Oh, thank you so much for having me. I mean, this is really important information, and thank you for educating families and out there.
Well, the pleasure is mine, and I'm only able to do it because of my great guest speakers like you. So thank you so much.
Thank you.
I really hope that you liked this presentation. If you want to take action on what you just heard, you'll find links to everything that was mentioned by our guest speaker right underneath this interview. If you love the summit and want to own the recordings in audio, video, and written form for all of these 2025 interviews, make sure to click the buttons on this page to get the 2025 EMF Pack. This EMF Pack is heavily discounted during the summit launch and for a very limited time. Remember that every purchase supports my work as an independent citizen journalist, as well as the nonprofit partners that are associated with this summit. Thank you for your attention and support, and I'll see you in the next presentation.